Lake County, California. 1,000 square miles of rural beauty. Many of its full and part-time residents are drawn here by the promise of a simpler lifestyle. Inevitably, though, the advantages of rural living come at a cost. Chief among them, the lack of readily available advanced medical care. What happens in the event of an emergency? A few years ago, that question became real for one Lake County resident who, despite the fact he worked at St. Helena Hospital, Clear Lake, found himself on the other side of the equation, as a patient experiencing a serious heart attack.
I'm a CRNA, which is a certified registered nurse anesthetist, and I work at St. Helena Clear Lake Hospital. And I work with the same people sometimes in the emergency room that I saw the day that I was having my heart attack. And my wife wasn't there at the time, just my daughter was at the time, was 9 years old. And she was smart enough and, with it enough to call 911. A big component of this experience was panic, terror that I'm just not going to make it. There's something hugely broken inside of here. And the paramedics showed up, they started my IV, they put monitors on each thing that they did. I was one step closer to feeling like there was hope. Yeah.
When someone comes in with acute cardiac failure, it is unbelievable the team response that patient receives.
And you're seeing people who you see almost every day, who are your comrades, who are your working force, who are working with you, all of a sudden work for you and work to help you through this horrible, panicky, blasting situation that's going to kill you if you don't have their help.
From the onset of symptoms to the definitive care, which is angioplasty, you have about 90 minutes. After that point, there's usually so much heart damage that whatever you do isn't very effective. So it's critical that from the onset of symptoms that the patient present here. So if we make the diagnosis, we usually will treat them with one of those clot-busting drugs and then transport them by helicopter to the appropriate place, which is, in this case, St. Helena, because that's where the definitive care resides. That helicopter is called every day, on multiple occasions, on most days.
Someone has a crisis in their life. They come into our Clear Lake Emergency Department. The patient deserves the right care in the right place at the right time. We have therefore connected two wonderful campuses in Clear Lake and in Napa Valley. We have a helicopter service that can move a patient in 13 minutes from the emergency department at Clear Lake into the high technology of St. Helena Hospital, Napa. Into the cath lab, into the OR, into the technology of a world-class center.
It was comforting to know that I had such a facility as St. Helena to, render me the exact care that I needed, and I knew that. Oh, that idea is powerful. I mean, it's helpful, it's healing. And as each professional came toward me with what he was to do, I stepped closer each time to my recovery, to seeing my wife again, or seeing my daughter and my son again, which I'm very thankful for.
For most of its 40-year existence, before the Clear Lake Hospital became part of the St. Helena region of Adventist Health, it was known as Redbud Community Hospital. It was built in 1968, a 25-bed facility designed to serve a much smaller rural population. Over the years, as Lake County's population grew and its needs changed, Redbud Community Hospital struggled to remain relevant.
Our emergency department is too small. It's too crowded. It's not a desirable place for our patients to be treated or our staff to work. But we still provide quality, compassionate care to our patients. When our new ED comes online, they're going to have the space, the equipment, the facilities, the technology to advance that care even further. Our vision for the St. Helena Hospital region depends upon an ED in Clear Lake that provides destination quality medicine.
And it is so important for our two campuses to function as one hospital.
The combination of aging infrastructure and growing patient demand has challenged the Clear Lake Emergency Department to maintain St. Helena's high standards of patient care.
One negative impact that population growth has had is on potential for motor vehicle accidents. When I first came to the county, there was only one traffic light in the entire county up in Lakeport. And now it gets to be almost a rush hour at times going over the mountain where people commute out of this area to surrounding regions for employment. When these accidents occur, it's a long way to any other hospital, and so we strive to provide the most comprehensive care that a small community can possibly provide.
We see an average of 50 patients a day in our emergency department. Sometimes that number spikes to 60. By contrast, at the St. Helena Napa Valley campus, they see less than half that number with twice the amount of space.
This hospital, as old as it was built with this as an operating room. And so it's been repurposed, if you will, to function as an emergency department. But it's crowded, it's antiquated, and it's very, very difficult to get things done. And I'd never seen anything like this. And I've worked in close to 30 hospitals in California over the years. I thought I was in a third world country. I really did. Everybody is so cramped together here. And so the physical space is very, very cramped. When you put that together with the number of people that show up to be treated for fairly serious conditions, it presents a very, very trying circumstance for all the people involved. Not just the patients, but the physicians that are treating the patients, the nurses that do a fabulous job in very trying circumstances.
To provide the highest level of care to all of the patients who come to our facility would be a tremendous tribute to our team of providers. We know a change is coming. We're hanging in there, yet it's a daily challenge for all of us.
Clear Lake absolutely deserves this 12 private room emergency department that is the front door to all of this care. Without that emergency department, we will never deliver the optimal services that are needed. With the emergency department, we will then take care of each person, and we will truly give each life the significance it deserves. For us to complete the construction of a 12 private room emergency department, to do this properly, takes a $12 million budget. And our corporation has challenged us as leaders of this hospital to go to our community, to go to our friends, and find just $3 million to complete the whole budget so that we can deliver the very best in emergency care services to our neighbors across the Lake County region. At any level of care that's being delivered, whether it's the arrival at the emergency department or opening the chest in the OR, we have to have excellence. And to achieve excellence, we must have an excellent platform. We must have excellent facilities, excellent technology. That has to be our passion, to have excellence on all fronts.